Welcome everyone. Welcome to the third and final session of this training series, how to develop a nursing care plan, a quick overview of a nursing care plan. Is everyone comfortable? Is everyone settled?
Yes.
Are you having a good time?
Yes.
Absolutely.
Enjoying thoroughly.
Okay. In this session, what we are doing is we just basically moving forward from the last session. So in the last session, we talked about, we formulated the skeleton of a nursing care plan. We did the assessment, and the second one was
Nursing diagnosis.
nursing diagnosis. What was the third one?
Planning.
We did the planning.
Implementation
And evaluation.
Yes. So we did all these steps.
Yes.
We made sure we found a person having an issue. We made sure we did what we are supposed to do. We evaluated. We found out if what we did worked or not.
Yeah.
What's the next bit? What makes that legal? How can you show someone
The
that
RN
I
should
did
sign
this?
it.
We should.
Consult with the, is there consultation?
Authorized.
How do you say you're doing something at job? How can you show it as a proof that I did this job?
Document.
You document it. You chart. You document. You write. If you're in that ancient sort of facilities, you write things. Or you
type.
you type
Nowadays you
things, right? So that's the document. That's the end part of it. You can't, if you didn't document, it didn't happen.
That's right.
You can say in a court that I helped that patient. I helped him this way. I carried out all these nursing activities. It doesn't mean anything unless you have a proof to show it in the court or to someone, right? So you have to document it. There are software that's been used in hospitals and clinical care settings that helps in documentation. Some people still use the old writing progress note method, but most of the hospitals are using digital software now. Just want to show you a quick short video of a fun video of a documentation regarding nursing documentation. You might be seeing this in the real life scenario as well. You know, it might be, there are people who struggle with digital online mechanisms. There are people who works with us who have no clue of how to navigate through the system, through a software. I think you can relate with what's been shown in this video. I think I'm one of those person because this is not working. Oh, that's why. I think
Control or delete. It always usually works well for me.
No, it's control enter.
all right, let me skip this ad. Okay, can you all see this?
Yeah.
I like him.
He looks like
I mean that I watched his videos
He's
before.
Nurse Blake.
Yeah.
Continue to monitor. Oh yeah, I would just put we'll continue to monitor. Will continue to monitor. Patient is a 64-year-old male from Orlando, Florida, the Sunshine State. Used to work at Disney in the college program. During college, he loves Tostino's pizza rolls and also cookies and cream Dippin' Dots. Hey, I have a question. Where do I chart restraints again? Hello, is this IT? Yeah, it's Blake from 4B, and I was wondering, where do I chart restraints? Oh, I don't know. I don't know what I did. Can someone please come and help? I don't know what button I pressed. Yeah, and I want to make sure I don't lose any of my charting. And that's a problem with this charting system. You know, they spent like $3 to $5 million on this thing. Yeah, and it sucks. And let me tell you the problem. The ER charting system doesn't communicate to the inpatient charting system, doesn't communicate to the outpatient charting system. So we're spending our whole shift like trying to figure out where to press, where to click, like all day. You know, I became a nurse so I could care for my patients, so I could spend time with my patients, but instead I'm trying to figure out how to use this multi-million-dollar charting system that doesn't even work. Are you guys leaving? Is it already time? You guys, I have so much more to chart. You know what? Just go ahead and go. I think I'm just gonna be late again. Hey baby, it's me. I just want to let you know that I'm still at work charting, so I'm gonna be late again. Yeah, just eat dinner without me. Yeah, I'm probably gonna be here for another hour or two or something. Yeah. So I'll just run by the drive-thru. Okay, I'll see you when I see you. Okay, alright. Bye. Hi everyone, my name is Blake and I am your charting super user for your unit. So I received about 2.5 hours of extensive training. So I'm here to answer any questions you have. I'm going to be here for the next 30 minutes. Your questions on how to chart, where to chart, when to chart, okay? So my one thing and one key takeaway I want you guys to remember is, you know what they say, if you didn't chart it, yeah, it didn't happen.
How did you find that video?
Yeah,
Is that
I
something
think
that you
that's- yeah.
see?
Yeah.
Yeah, you might, in any, it doesn't matter if it's a healthcare field or any sort of field, navigating a software can be really challenging for many people. Some people just ease through it, whereas some others really struggle. If there is a change in it, if there is an update in it, then we are all struggling,
Yeah.
right? And then comes a champion who is the savior to come and help all these people. So charting, unfortunately, charting and documentation is something that we have to do. It's a legal requirement. It's something that shows that we are doing what we are saying that we are doing, and to give continuity of care as well. So any questions in that at all?
No, it is important. That's
It
absolutely.
is an important thing, yes. Okay, let's move on. Next one would be an activity to do. Have you heard of Kahoot?
Yes.
We will do a Kahoot. Okay, so do you all have your smartphones with you?
Can we use phone?
Yeah, you have to use the phone in this. Okay, give me a minute. Let me bring this up. So if you type, if you type Kahoot in Google and the first answer, the first search answer that comes up, just click on that. Okay.
This one you mean?
Yes,
The online Kahoot, this one?
that's the one. Yes. Okay. All right, are we all ready?
Yes.
Yeah.
I'll turn this around so you can see this as well. So basically there are a few questions in here, and there will be 20 seconds for you to answer. So you read the question, you answer it. The first person who clicks on that will get the first mark.
This price is there, teacher.
We will think about that. We will look into that as well. Okay, ready?
What's the game pin?
Do you have game pin?
There should be a green pin, isn't it?
Yeah.
Let's see. What's happening?
Is an alpha numerical number sometimes.
Okay, so I will read out the pin now. 371
Yeah.
8567. Just
Okay.
yell out when you're in.
I am in.
I'm in.
There you go.
You can
Anish, Shilpa, JJ. Are we waiting for one more? NK. Wonderful. You ready?
I'm alive.
All right.
You're a
there we
monkey.
go. Let's start.
Kahoot. Get ready. Get ready.
Your patient seems to be upset and fidgety. There are family members present too. Your initial priority plan goal will be? Is it comforting the patient? Let the patient family deal with it together. It's not your problem. Is it your own safety the main priority? Or tell the patient to be happy all the time? Got it?
Yep.
Everyone? Let's move on. Shilpa did it first, so she got. There you go. So you got an idea of how to do this now.
Yep.
All right. Let's do the same. Ready for the second question? A patient complaining of a creepy co-patient and bowels not open for 4 days. The same patient has not opened bowels for 4 days. Got wrong food from the kitchen. What's the priority need? Try and shift the creepy co-patient to a different room. File a complaint to the kitchen. Try and get the doctor to prescribe sedatives or manage the constipation. All done?
Yep.
What do you think the answer is in here?
Manage
Marriage
constipation.
constipation will sort out all the problems.
That's the one of the main thing here, isn't it? One of the main problems here. Have you heard about Maslow's hierarchy?
Yep. Of needs.
Yeah.
Yes.
Maslow's hierarchy.
Yeah.
It basically says that the physiological needs come first. If a person is hungry or a person is guilty, person is thirsty, you deal with that first.
Basic needs completely.
Basic, exactly. The basic need comes first. What will be the second one? The safety, the security. That all comes next to that. Then comes love and belonging. Then comes the
Self-esteem.
self-esteem, self-actualization. The topmost needs comes at the last, right? The basic needs are supposed to be met first. So in this scenario, yep, there is a person a co-patient who is creepy, or this person is feeling a bit unsafe here, but that's not the main concern. Wrong food came from the kitchen, but at least they got some food. So that's not the main concern either. If the person has not been going to toilet for 4 days, we deal with that,
That's the
right?
problem.
There you go. So that's the point level now. All right, let's move on. So that's, I've just put in something that it's not a quiz. This is just to show that physiological needs, then safety needs, then belongingness and love, esteem, and then self-actualization comes next. Physiological needs come first. The nurse should prioritize managing the constipation, right? Let's do this next one. How can you evaluate the effectiveness of regular position change in a bedridden patient? Can you do that by when you see that the person has good skin integrity, maintains good range of motion, the patient hasn't slept? How did that happen? Oh, everyone did this already.
No.
Patient hasn't slept. Patient hasn't slept for 2 nights. The patient complaining to the family about disturbance. We're going and changing the position of the patient every now and then. Say someone is bedridden, and we, as a nurse, we are going and changing the position every now and then. How can we say it worked?
Patient skin
when there
is
is no pressure
source.
Exactly. The person can complain that this nurse is coming and disturbing me at night time. That is an issue, but the main concern is skin integrity. So you do that. There you go.
We haven't got the
Some
chance to
technical
click.
problems
Yeah, some technical
more
problems.
We took more time to read, that's all. We have to be very fast.
But why it's locked only one?
The time is up.
You only I think you
The
have to-
time's up. That's the issue.
Time is
But
up.
that was, I think, a little bit
Early.
Yeah.
Yeah. Okay.
No, I don't think so.
We'll reduce that. We'll take away
You can
that
take
score.
500 points.
We'll take 500 points away. Okay, next one. What is the main goal of a nursing care plan? To increase workload of the nurses, to keep up with the new nursing students, to ensure all works are completed before the shift ends, or defines clients' goals. It's okay. It's not a big competition.
I pressed wrong.
All right, let's have a look. There you go. Shilpa got that right too, I think. What are the possible interventions for sleep issue due to pain or discomfort? Does healthy meals help? Does empathy help? Asking for sedatives or limiting the visitors and analgesics? Got it? All right. There you go. Good. What would be the main goal in this scenario? Can you look into that scenario? What's happening there? A nurse is trying to take a person maybe to the toilet or for a walk.
Yeah.
What do you think a main concern is here? What can be an issue, a hazard, a risk?
Trip hazard.
It can be, right?
Yeah.
Let's have a look. What would be the main nursing goal? Daily showers and toileting, early discharge, falls prevention, or going to check on other patients. Are we all agreeing on falls prevention here? That's what I think it is. There you go. Things are moving there. Check your prioritizing. This person is bedridden and is unable to verbalize. You notice that the patient is showing facial grimacing due to pain, low urinary output, ineffective breathing pattern, and increased swelling in all the joints. What would be the priority? What are we going to deal with it first? The first one is pain due to facial grimacing due to pain, low urinary output, ineffective breathing pattern, and swelling. Which one are we going to deal with first? Manage the pain, or ensure proper airway, or unblock the urinary catheter, or check kidney and liver blood results. That's taking a long time, isn't it? There you go. Well done. What are the different steps of nursing care plan? Assessment, a dash, planning, implementation, and evaluation. Is it nursing diagnosis, gossiping, administering, or measuring? I'm sure everyone got that right.
Yes.
The third one is MK. There you go. The second is Anish. And the first in this game is Shilpa. Well done.
Well done. Congratulations. Thank you.
There you go. Did you have a good time with that game?
Yes, that was
Was that a good one?
Yeah.
We learn something new every day. Please.
There you go. So let's wrap all this up now. Let's wrap the training session here. Let's just think about what we learned in all 3 sessions. So we first looked into what a nurse should be, how a good nurse should be. We all have perceptions in our mind. We all had different experiences in the past with a good nurse, right? But we may or may not think why that person was good, why we thought that person was good. There is a reason. There are criteria that nurse met that made her good or made him good. And those are the points that we talked about before, like dedication, knowledge, empathy, compassion. What else? Like knowledge, all those, exactly, listening. All those characteristics make a nurse a good nurse, right? And then to be a good nurse, now we are trying to become good nurses. What can we do? We have to do our care in a step-by-step manner so that we are not missing things, so that we observe everything. And then we plan our care, we observe it, and then that's the assessment bit. And then we
Find out the diagnosis.
we find out
The
why
nursing
that's
diagnosis,
happening.
yeah.
Exactly, nursing diagnosis. Then what we do after
Plan.
after that we
Plan.
plan. We plan the
Implement,
outcome.
yep.
We have to think about what the outcome should be, then work towards that. Right? We think about the man should be happy, the person should start walking, the person should have good skill integrity. So those are the outcomes, those are the goals. So what can we do for it now? We make the implementation. Then what we do?
We evaluate whether
We
it's working.
evaluate. Exactly. What if it doesn't work?
We have to go
If
back
it
and
go back
redo.
We redo it again. What if it works?
Document.
You think about that again and then make sure that is there anything that we can do to make it better?
Better.
Is there other things that we can add on to it? Is there a new update? Is there new studies coming that we can use? So keep up to date your knowledge all the time. Look into new studies, look into different scenarios that other people have used, other implementations that other nurses have used. Can we integrate all that into our practice as well? So we're continually evaluating what we do. Can we just take some time to discuss about what you understood from this training session today? Or anything that you would like to add onto the session?
I do have a question, Minu. When you mentioned that, then you have mentioned about the importance of care plan, how we have to do a care planning, what it constitute to become a good care plan, things
Yes.
like that. So when we make a care plan for a patient or a client, is it just only one-on-one care plan, or do we have to review that often?
It's definitely an ongoing process. We have to continually look into it, continually evaluate what we did, and if there is anything changed, we have to go back and redo the whole thing again. As I said, if there is if we found that the implementation that we did worked and the goal was met, then we have to look into how can we make it better again. If it didn't work, we go back and we look into different implementations so that we can have the outcome, so that we can get the goal. So it's an ongoing process. Yes. Anything else that you would like to add on to?
Do care plans, are care plans important in all healthcare settings, or is it specific to certain?
It is definitely
Industry.
important to all healthcare settings. We have to, the main motto or goal of healthcare is to help a person,
Yeah.
right? So to help a person, we need to understand what that person needs.
Yeah.
What's the need that we have to meet? So I think nursing care plan is not just into nursing. It can be for any other sector as well. To reach a goal, to find that, to meet a criteria, You have to first understand, recognize if there is a problem, understand the problem. You look into what needs to be done, then you implement what's supposed to be according to the goal. We implement our actions or intervene, and then we evaluate what we did. I think this can be applied to any, not just the medical or clinical scenarios, but other outside medical scenarios as well.
That's right.
Yeah, so it's not just a hospital.
Specific to hospitals.
Exactly, it can be anyway, can be used anyway.
Yeah.
Anything
Thank you.
else?
I really like the last part of that care plan process, like evaluating by involving the client or the patient in the care planning, so that
Yes.
they will know that whether they will come to know that what all actions we have taken, what we have planned, and what we have implemented, and whether it was effective or not. If it was not effective, we are discussing with them to make sure that we are involving them and asking them how can we make it better. In that way, we can do a
Involve.
person-centered care to that client.
Exactly. Shilpa just brought a really important point in care plan. It's not just in the mind of a nurse. It's not a one-man show. It's done with the patient, for the patient. It involves the family members. It involves multidisciplinary clinicians as well. It's not just the nurse there, isn't it? You go to a hospital or a clinical setting, there might be doctors, there might be allied health, there will be family and the patient themselves. So you sit with them, you make the goals according to what they feel about it as well, what goals they want in their life as well. So yes, it's a really good point that you just mentioned there. It's done with collaboration with all the stakeholders, not just the nurse. That's a really good point, Shilpa.
Like how, in medical terms, how often we need to evaluate a care plan? Like, is there any particular time frame?
It's you can't just put a time frame into it. So you basically, when you do, it can be done 2 times in a shift. It can be done once a shift. It can be done once a week. It
No, what I'm
depends
asking
on
is,
yes.
A care plan should be evaluated.
So you're talking about the legal part of it, isn't it?
Yeah.
But in most of the clinical settings, a care plan, if it's a chronic disease or if it's a chronic care plan, you have to at least do every 6 months or 3 months. Every 3 months, depends on the facilities as well, I think. But 3 months is just a main, like most of the places you have to do it at least every 3 months. And as necessary as well. If things are changing in between, you need to look into that again. Things will change again.
Yeah, it has to be relevant at all times.
Exactly. That's a good point there. Anything else that you would like to?
Nothing.
Thank you for your time.
Thank
Thanks
you.
for your time and effort.
Yep.
Thank you.
Thank you.
Thank you.